Built for the call. How first responder weight rooms support strength, readiness, and career longevity. First responders work in environments where physical readiness can directly affect performance. Firefighters, police officers, emergency medical technicians, paramedics, and rescue personnel may need to lift, carry, push, pull, climb, drag, sprint, kneel, or work for extended periods while dealing with unpredictable conditions. For this reason, fitness facilities designed around occupational needs can play an important role in preparing personnel for demanding calls. First responder weight rooms are more than ordinary workout spaces. When properly designed, they provide an environment where public safety professionals can develop strength, cardiovascular capacity, mobility, power, and muscular endurance while fitting training into demanding shift schedules. Current first responder fitness guidance emphasizes functional movements and a combination of strength, conditioning, mobility, and job-specific preparation rather than training solely for appearance. What are first responder weight rooms? First responder weight rooms are dedicated fitness areas located in or near fire stations, police facilities, EMS centers, training academies, or other public safety facilities. Their purpose is to give personnel convenient access to equipment and space for structured physical training. Unlike a conventional commercial gym, the design can focus on the movements and physical qualities associated with emergency work. A well-planned facility may include free weights, racks, cable machines, cardio equipment, kettlebells, resistance bands, functional training tools, and open floor space. The goal is not to recreate every emergency situation inside a gym. Instead, the room should develop physical capabilities that transfer to occupational tasks, including lifting, carrying, climbing, pushing, pulling, stabilizing, and working under fatigue. Why strength matters for first responders. Strength is one of the foundations of occupational fitness. A firefighter may need to move equipment or assist with a rescue, while an EMS professional may repeatedly lift or reposition a patient. Police officers may have to control a physically resistant individual or move quickly over difficult terrain. Resistance training can help build the muscles and connective tissues involved in these activities. Exercises such as squats, deadlifts, presses, rows, carries, and controlled pulling movements can develop whole body strength when performed with appropriate technique and progression. The most useful approach is generally not to chase maximum lifting numbers every workout. Instead, personnel can build a sustainable level of strength that supports performance while allowing adequate recovery between demanding shifts. Functional fitness should be at the center. One of the defining characteristics of effective first responder training is functional movement. First responders rarely perform isolated bodybuilding movements during emergencies. Their work usually requires multiple muscle groups to cooperate while the body moves through different positions. A functional training area might therefore include squat and hinge movements, loaded carries, pulling and pushing exercises, step-ups and climbing movements, core stabilization exercises, sled pushing and pulling, kettlebell movements, sandbag training, crawling and floor-based movements, medicine ball exercises. Research into first responder-focused functional training has also explored workouts combining physically demanding movements with emergency-related tasks, highlighting the importance of preparing personnel to perform under substantial physiological stress. Essential equipment for a first responder weight room. A facility does not necessarily need every piece of commercial gym equipment. Instead, equipment should be selected according to available space, budget, personnel requirements, and training objectives. Power racks and barbells. Power racks provide a foundation for exercises such as squats, presses, and deadlifts. They can support progressive strength development while allowing several variations of fundamental movements. Dumbbells and kettlebells. Dumbbells and kettlebells are versatile choices for limited spaces. They allow unilateral training, carries, presses, rows, swings, and other movements that challenge coordination and stability. Cardio equipment. Cardiovascular conditioning is important because emergency work can involve repeated bursts of intense activity. Treadmills, stationary bikes, rowing machines, stair climbing equipment, and similar machines can provide different conditioning options. Visit the link in the description below for more information.